Good afternoon, everyone. My name is Ann Wong, and I am with the Illinois chapter, American Academy of Pediatrics. Thank you for joining us for today's webinar with Healthcare and Family Services on the Medy system and eligibility. Before we begin the webinar, I would like to go over a few housekeeping items. Participant phone lines are muted. This webinar is being recorded. If you have any questions during the webinar, please enter them into the control panel on the right-hand side of your screen, and our presenter will answer them after the presentation. After the webinar, everyone will receive an email with a link to today's recorded webinar. Today we are joined by Gina Sims from HFS. Please join me in welcoming Gina. Okay, Gina, you can begin now.
Good afternoon. I'm Gina with the Illinois Department of Health Care and Family Services, and I'm going to guide you through our website today and show you some of the resources that are available to you. This web page is going to provide a lot of useful information. So we're going to go to www.illinois.gov/HFS. That'll take you to our home page. You're going to hover your mouse over medical providers and click on non-institutional providers. We're going to go to the Medy home screen. And this is where there's going to be some important messages regarding Medy. It's going to tell you the version of Java that you have to use, and it's going to give you messages displayed on the screen if there's a system problem with Medy at the time. Now, the only version that's currently available for Java after 9.13/16 is the Java 8 Update 101. If you don't have the Java 8 Update 101 or higher and cannot log into the Medy system, you're going to have to update your Java. Also, if your password is over a year old or it's been 90 days since you used Medy, you may have to change your password. You must use Internet Explorer to use Medy. It will not work properly with any other browsers. The first thing you're going to want to do is obtain a user ID and password if you don't already have one. How to do that is you're going to go to Register for Medy. You may get Select Digital ID. If you do, please select that. If you get this page, select Run. Click Allow. This is going to take you to the State of Illinois Digital ID Subscriber Agreement. You're going to read this, and you're going to scroll to the bottom, and you're going to click on Illinois Accept. This is going to bring you to a web page where you have information that you need to enter. Please enter all the requested information and click Submit. And this is all the farther I can take you in this part of the presentation. Once you do get your username and password, it'll take you 2 business days before you'll be able to log into Medy. Now, once you've enrolled as a provider in the Impact system, you will get a provider information sheet. You're going to use this to register your provider information within Medy. Now, you're going to need to select an individual to be the administrator, and this person will be responsible for giving other people access to use the Medy system for your provider. The first thing you're going to do is you're going to go to Medy Login, and you're going to log into Medy. Once in Medy, you're going to click on the registration menu. In order to register as an administrator, you're going to click on Medicaid Provider. You're going to enter the requested information exactly as it appears on your provider information sheet. Then you're going to click Submit. The next thing the administrator will do is go to Manage My Account to get an employee registration key. If the system will move. I apologize, the Medy system is running slow today. Here you will see is the employee registration key, and you'll need to write that number down because this is what you'll need to grant other employees access to enter or look up information for your provider number. So to obtain access for an employee other than the administrator, you're going to have the employee log into Medy using their own ID and password. Then you're going to go to the registration menu again. And then you're going to click on employee registration. You're going to fill out the information requested on this screen and click submit. Now, if you go back to the non-institutional providers page, we do have a link to the Medy registration screen. It's right here under the Vaccine for Children section. Now to check eligibility in Medy, you're going to log back in to the Medy system, and it will bring you to this screen. You're going to click on Internet Electronic Claims System, and then you're going to go to Eligibility Inquiry. Your provider ID and NPI number are going to be in the drop-down boxes. And then you're going to want to begin date and end date. You're going to want to use only the date of the clinic or date of service that you're looking for. Otherwise, it may bring back a lot of results for you. So we'll enter. Oops. We'll look up today's date. Don't ever use a county, because if the recipient lives in a county or her case is in a county other than the one you select, it's not going to bring back any results for you. So then you click on Submit. You're going to see that this tells us the client is eligible for limited benefits, and the case type is DHS Social Services only. When a recipient is DHS Social Services and that is the only eligibility they have, they are not eligible for Medicaid and do not have any type of medical benefits. So we're going to go to New Inquiry, and then we'll enter the next recipient that we want to look up. And you'll see that the case type in this one is Medicaid eligible, full coverage. Then you want to look at the special information section, and you will see that it's Title 19. So you would use the VFC stock and you would bill HFS. On our non-institutional provider webpage, I'm going to go over some examples with you of different eligibility scenarios. Now, the billing of VFC vaccines for Title 19 eligible children is not going to change. For Title 21 and state-funded children, you're going to use private stock vaccines, and you're going to bill HFS or the managed care organization. You're also going to use, the date of service, case type, and special information to determine eligibility and whether to use VFC stock or private stock. In this case, you'll see the case type. If it's all kids Medicaid eligible, full coverage, and they are Title 19, you're going to use the VFC vaccine and you're going to bill HFS. If they're Title 19 and belong to a managed care organization, you're going to use the VFC vaccine and you're going to bill the MCO. If they're Title 19 and have third-party liability, you can choose based on the payer source whether you're going to bill the commercial insurance or whether you're going to bill HFS. Providers are not required to bill the primary insurance for preventative services to children. The VFC stock will be used. For case type, all kids share, full coverage, or all kids premium level 1. If it's Title 21, you're going to use private stock. If it's Title 21 with managed care organization, you're going to use private stock and bill the MCO. If it's Title 21 and third-party liability, you're going to use private stock, and again, you're going to want to choose whether you bill the primary insurance or whether you bill HFS. All kids premium level 2, full coverage, that is state funded. If it's state funded, you're going to use private stock and bill HFS. If it's state funded and the managed care organization, you're going to use private stock and bill the managed care organization. If it's state funded, you're going to use private stock and choose to bill primary insurance or HFS. If the coverage is DHS social services only, the recipient has no medical coverage and it does not apply to vaccination. So if you look at this example, you'll see the case type is all kids, Medicaid eligible, full coverage, and the special information will tell you it's Title 19. And you'll see by the blue line that it's a managed care organization. This has a plan code that says 19. That is not the title information. This is just the plan code of the managed care organization, and that plan code will tell us that that managed care organization is Meridian. So in this case, since it's Title 19, you're going to use the VFC stock, and you're going to bill the managed care organization. For this example, the case type, all kids share, full coverage, you'll see under special information, this one is Title 21, and they have managed care organization. So you're going to use private stock, and then you're going to bill the managed care organization. This example, you'll see the case type is all kids premium level 2, full coverage. The special information is state funded. You'll notice there is no managed care organization segment on this, so you're going to use private stock and you're going to bill HFS. If you enter a date span, say 4/1 to 5/1 of 16, you may get several eligibility segments. So you'll see on this one from 4/1 to 4/30 of 16, the recipient is all kids premium level 1 and they're Title 21. So for those dates of service, you would use private stock. Then for 5/1 of 16, the recipient's cover changed to all kids Medicaid eligible, and now they are Title 19. And on date of service 5/1 of 16, they had managed care. So for this date of service, you're going to use the VFC stock, and you're going to bill the managed care organization. DHS, this does not cover have any medical benefits, and it does not pertain to vaccinations. So you'll see you can have two segments. On 7/20 of 16, the recipient is eligible for benefits, has all kids Medicaid eligible full coverage, and is Title 19. But they also have a DHS social service segment for that same date of service. We're going to disregard the DHS social service segment because that does not apply to medical benefits. So you will use this special information, Title 19. You're going to use a VFC stock, and then you're going to bill HFS. In this example, you'll see that they have DHS social services only, so that participant has no medical benefits through HFS. In this instance, you'll see that the participant has all kids medical eligible full coverage, Title 19, DHS social services, we're going to disregard that. So their Title 19, you'll use VFC stock, and you'll bill the managed care organization. In the next example, you'll see the case type, All Kids Premium Level 1, Title 21, and Managed Care. You're going to use private stock, and you're going to bill the managed care organization. In this one, there's third-party liability. So you're going to see on 916, they were full coverage. Title 19, they have DHS Social Services, which we're going to disregard, and they also have third-party liability. So in this case, you're going to use the VFC stock, but you're going to choose whether to bill the primary insurance or whether to bill HFS. You do not have to bill the primary insurance for preventative services to children. In this instance, you'll see that it's All Kids Premium Level 2. Special information is state funded, and they have third-party liability. So you're going to use private stock vaccine, and you're going to choose whether to bill the primary insurance or whether you're going to bill HFS. So if you go back to our home page, and you scroll down, here are the example slides that I just went through for your use. Here are vaccination billing instructions for fee-for-service billing to HFS. Very soon we're going to have available vaccine billing instructions for encounter rate clinics. The pediatric vaccine reimbursement rates are not quite available, but they will be available soon. The rates are going to be posted here during the conversion. However, in the future, you will need to use the fee schedule. If you scroll down farther to the bottom of this page under the links, you will see fee schedules. If you click on fee schedules and then go to the practitioner fee schedule, you'll want to click on the most updated fee schedule, and that's where all the fees, the fees will be. Now, once a child has applied for Medicaid and is entered into the system, it's usually a very quick process for them to be given temporary eligibility as long as they have not had temporary eligibility in the last 12 months. The temporary eligibility is considered full coverage, and it will show in the Medy system with the title information. For patients who have a pending application, they are considered uninsured and are eligible to receive the VFC product. If the patient is later determined to be Title 21 or state funded, the provider should bill the department for the private stock and follow the instructions found in iCare for replacing the VFC vaccine from private stock. If you scroll down here at the bottom of the vaccinations for children, you'll see there's a question and an answer guide. And then also, if you have questions regarding any co-payments, there's a question and answer guide under liability and co-payments. Are there any questions?
Okay, thank you, Gina. So one of our questions is, how long should it take to be approved if we have a Missouri DL?
That I am not sure. I don't know how long that's taking right now. We do have a Medy help desk where you can find that information. The number is 312-814-3648.
Can you repeat that again, please?
312-814-3648.
Okay, and that is the Medy help desk.
Yes, it is.
So another question is, if you had a login and password before, do you need to register again?
No, you do not.
Okay, so they would probably just need to reset their password.
Yes, that's correct.
Okay, and then how do we know who is the administrator for our agency?
You would just have to select someone to be that administrator.
Okay, and then another question is, will there be a step-by-step guide for this that will list the different type of case types?
The information is currently on the website now. On the, Gina took you through the non-institutional provider main page, and she took you through the slides or through the document that is listed there now.
Okay, and then someone asked if this webinar is being recorded, and I just wanted everyone just to know that it is being recorded, and I'll be emailing everyone a link to the video for the webinar.
And if you go on the website, if you're looking at the webinar now, the Medy example slides that Gina took you through are right here in a PDF format.
Okay, and then what page is that so people can go to it easily? Is it under the non-institutional?
Yes, it is.
Okay, wonderful. So you would just scroll down a bit and then you would be able to see that PDF that has a lot of the useful information.
Right. And they can go to www.illinois.gov/HFS. When we get there, hover your mouse over medical providers, go to non-institutional providers, and then the slides are under the Vaccination for Children heading.
Okay, awesome. That's definitely a great tool to have for everyone. And then someone wants to know, what if the provider isn't in the MCO network? How is that visit billed?
You would have to become enrolled with the MCO network in order to bill for those services.
Okay. And then does HFS electronically pass the Title 1921 state funded to each MCO?
The department will send the eligibility information to the managed care entities.
Okay. And then where do we see if a patient has TPL?
That will also be on the Medy system under the eligibility screen.
Okay.
And we can show you that here on the sample website.
Oh, there it is.
The third-party liability, an example of that on the Medy screen, is on page 11 of the document. You'll also find the information on page 12. Third-party liability section is labeled and is at the bottom of the Medy page.
Okay. And then someone says that they use a third-party program for checking eligibility. Will HFS be passing the special information section on to these providers?
The department already passes the information, and what your vendor, we send the information to the vendor, and the vendor displays the information to the provider. So you're going to have to talk to your vendor to see how that information will be displayed to you at your office. That's between the vendor and the provider.
Okay, and can you check all Medicaid patients through the Medy system, i.e. Blue Cross Blue Shield, Aetna, Better Health, Illini Care?
Yes, you can.
Okay. And then what is the process for out-of-state users? Some employees live out of state and work in Illinois, but they're unable to register without Illinois ID or driver's license.
Just a moment and I will show you. Oh, goodness. When you go to that Illinois user agreement, at the bottom there is a link that says non-resident users, and there's a form that you're going to have to fill out and then mail in order to get access to the Medy system.
Okay. And so if someone had a username and password with a different organization, do they need to re-register for Medy?
Yes, they will have to register for Medy.
Okay. So for someone wants to know how newborn coverage will be determined.
Newborn eligibility is based on the mother. If the mother is Title 19, the child will be Title 19, and most mothers are. If the mother is Title 21, you will have to wait for eligibility. The new IES system will allow a provider to add a newborn. However, it's not up yet, that portion. And so at this time, you'll need to wait, or you'll need to contact the local office to add the newborn, so you can determine the eligibility. That information will be updated. It's currently in the frequently asked questions, and it will be updated when we get more information on adding the newborn.
Okay. And
going back to the out-of-state users, if you go to the subscriber agreement and scroll down to the bottom, it says non-Illinois resident accept, and then it has an application instruction, and this will show you the application form that you need to fill out and what the process is to become a user.
okay. And then what is the number to call when Medy is down to verify eligibility?
We have an eligibility hotline, but that will not give you title information.
When the Medy system is not available, you can call the AVRS system, but you're going to have to bypass all the systematic prompts and wait for an operator. The number is 1-800-841-1461. That, again, is in the frequently asked questions and answers. And that number is available only when Medy is down. If you go to the Medy homepage, it will have, that is on this page, it will let you know if Medy is down. If there isn't a message that's saying Medy is down, and if it's not posted, Medy is not down. You'll probably want to check your Java update or your password. It's usually a user issue. Medy has been proven reliable.
Okay. And then does the Medy system allow providers to see patients' redetermination dates?
No, that information is not available on Medy.
Okay. So if someone does not yet have access to Medy, should they call a number, or what should they do in that case?
They would want to go ahead and get registered for Medy so they can use that system.
Okay. And is there a number that they can call in the meantime, or no?
The number they can use is the hotline.
Right.
Again, we don't encourage use of the hotline because you will have to wait. Whereas Medy is going to allow you instant access. Once you have the digital ID, registration takes about 30 minutes.
Okay.
And checking eligibility, as Gina took you through a couple recipient numbers, it takes about 30 seconds or less than 30 seconds from one patient to another.
Okay. And then how do we backdate the eligibility for a newborn?
I'm not sure of the question.
I think
DHS backdates, a child is eligible to be backdated to their birth. If there's an issue, you can certainly email the HFS webmaster and receive an answer.
okay, sorry. Just scrolling through the questions. So I think someone said that a rep that they spoke to, said it takes about 15 days for the provider information sheet to be mailed. So until they receive it, is there a way to verify eligibility or no?
Yeah, until they have their provider number, there would not be any way for them to check eligibility.
Okay. How do we add users to the Medy system?
You would go to register for Medy, and each user would have to sign up for their own login ID and password. And once that's done, then you'll go to the registration menu. On the left-hand side of the registration screen, and that's where you're going to go to employee registration, and the administrator is going to give them that registration key so they can sign up to see the provider in their own drop-down box.
Okay. And then can you explain again how to check Title 19 and 21? Where do we go on the screen? If they're Title 19, can that change over time, or is it the same?
It can change over time. If you go to the Internet Electronic Claims System, go to Eligibility Inquiry, select your provider ID and your NPI number, put in your date of service, type in your recipient ID number, select Submit. Again, you're going to use the case type. You see that's Medicaid eligible full coverage. Down at the bottom of the screen, it says Special Information, and that's where it's going to give you the title information. This one's Title 19.
Okay.
A new inquiry. And you'll see on this one, it is also Title 19.
Okay, and another question is, for registration, it asks for provider number and provider type. Is this the tax ID number, and what are we to use for provider type?
That is all going to be on your provider information sheet when you get that in the mail.
Okay. And then what's the provider type?
It depends on the type of provider. You know, physicians have their own provider type. Clinics have their own provider type. That's going to be on the provider information sheet.
And then someone wants to know, how do they find the provider information sheet?
Once they're registered in Impact, they will be mailed a provider information sheet.
Okay. And then someone says that they have a client who is Title 21 and is 4 months old, but the parent was told HFS classified them wrong and they changed them to moms and babies, and they are a Title 19 now. But when we run them in Medy, it still says Title 21. How long does it take to change in Medy?
The Medy information is updated every day. It depends on how long something else can be updated. But if you should be looking at the information on Medy for title information and not a patient. You should be getting that information from Medy and not a patient.
Okay. And then if we are currently using eCare to check eligibility, is this the same as Medy?
Providers may be contracted with a vendor, and eCares is a vendor who's receiving the information from us and then displaying it to you. You need to talk to your vendor to see where the title information is going to be presented and how it's going to be presented.
And then is the recipient number the Medicaid identification number?
I'm sorry, can you repeat that question?
Is the recipient number the Medicaid identification number?
Yes, it is.
Okay. And another one is when a MCO does not recognize recipient on their system and they're clearly on Medy that they have full coverage, should the provider call Medy? Sorry, I don't really understand that question.
If Medy shows the client eligible under a MCO and the MCO does not have the eligibility information, you should call the managed care. Oh, I don't want to give the number of someone without telling them. You could contact 877-782-5565 and talk to one of the physician consultants, and we will be able to assist you with that.
Okay, and then with regards to newborns, is there...
I'm sorry, go ahead.
Oh, okay. With regards to newborns, is there still a 90-day open enrollment period, or are newborns automatically assigned to the insurance that the mother has? If the mother has a managed care plan that our pediatric office does not accept and we see the newborn within the first 90 days, will the mother's plan pay?
There should be eligibility in Medy for the child, and just a mother's eligibility does not determine a child's eligibility for sure. You want to look at the Medy information.
Okay.
If you're looking through, looking at the website, I'm not sure, we are trying to find a provider information sheet for you to, so we could show you where the provider type information will be, because you probably already have it. I will also add information on the provider types on the frequently asked questions. So most providers who are on this call and administer the VFC vaccines are physicians who are provider type 010, clinics. So I will add the most obvious choices in the questions and answers to assist you and make it easier.
Okay, and then is the plan code relevant when verifying which title a patient has?
So the plan code is something that's assigned to the managed care organization. That just tells us what organization they belong to. When you saw plan code 19 on some of those, that tells us that that's Meridian. And we do have some information on care coordination on our website that will tell you that information. Just go to the care coordination page.
Okay, and does each provider need to be registered separately, or can we register a group of physicians that work on one site?
Each physician is going to have to be enrolled separately.
However, if you have 10 physicians in your office, you only need to access Medy using one login. It doesn't matter if Dr. Jones, you're using a login associated with Dr. Jones, you can check everyone's eligibility for the whole clinic under that registration.
Okay, can a provider log into IES to update a patient's demographic, gender, or other insurance information?
We can't answer that question. We don't know IES.
Okay, and then will the enrollment sheet come to the office or the home address?
It will go to the pay to address, whoever the payee is. So if it's the clinic, you know, Dr. Jones' provider information sheet would probably go to the clinic that he's working for.
Okay, and then how does the administrator get the key? We don't know who the administrator on file is.
The employee key,
Just says key.
under the, okay, on the registration menu, or go to manage my account after that it's registered, and it'll give you the employee key. If you have several providers that are registered under your login ID, each provider is going to have its own registration key.
Okay, and then if you float to another location and work with a different group of doctors, are you able to verify their patients under the original sign-in?
Yes, you would still log in using the same login ID number. You would just register that other provider as well. And then when you go to the eligibility screen, let me show you. You'll have all of those providers in the drop-down box. So if you work for Dr. Jones in Springfield, and then you work for Dr. Sims in Jacksonville, you can select which provider you want to look at your eligibility under.
Okay, Someone wants to know if Medy is replacing NEBO.
NEBO is a third-party vendor, and we do pass that information to them, but you would have to contact the vendor to find out where on their website or where on the information you see would have the title information on it.
Okay, how does the system allow access to non-Medicaid patients?
Medy will only display information regarding recipients who are eligible under the department's medical programs. If you're talking about why do we show the social services information that does not pertain to medical, I do not have an answer for that, but it does not apply to any type of medical coverage.
Someone wants to know how to get to the non-institutional providers page.
Go to www.illinois.gov/HFS. That'll bring you to this page. Select medical providers. You can do it out of the drop-down, or if you click on medical providers, it's going to bring you to this page here. You're going to click on the purple square that says non-institutional providers.
Okay. And then if a clinic chooses not to service CHIP clients, can they still service VFC qualified clients?
Yes, a provider can choose which clients they want to render services to. And if you go to the questions and answers page, we have links available to our NIPS page and also to our different sections. The questions and answers has information regarding the question that you just asked, whether or not you had to see patients. We also have telephone numbers for Medy assistance. Again, more information on the NIPS page. We're going to continue to keep the NIPS page information updated while we transition for this VFC project. We are trying to help you, and I will add the questions that you have asked in this session today if they're different. However, most of them have already been addressed here. Still, if you have a question that has not been answered, we do have a main, the webmaster page where you can ask questions and it will come to us. We can be accessed at this number as well. You want to go to the NIPS billing consultants when you get to this number. You can ask a physician consultant any of the questions that you've asked in this webinar. If they don't have an answer for you, you can leave the question with them and we'll get back to you.
Okay, so it looks like a lot of the questions aren't really pertaining to the Medy website in particular anymore. A lot of them have to do with clinic and encounter rates and things like that. So yeah, and about reimbursement rates, which I know that Gina announced earlier that they haven't, correct me if I'm wrong, Gina, that they haven't been finalized yet, correct?
Yeah, that's correct.
Okay, so those questions can't be answered at this time. Oh, but so someone wants to know how fast the turnaround is for the MDs to be added to the network?
I don't know how long that's taking now. That's all done through the impact system.
Okay. So concerning this like Medy eligibility website in particular, there aren't really any more questions about that. So Edna and Gina, I think this would be a good time then to end the webinar if you guys don't have any more comments to make then.
Nope, I don't have anything else to say.
Okay.
Thank you.
Okay.
No, thank you.
Okay, wonderful. So thanks for joining us for today's webinar. We hope that we were able to answer some questions about how to navigate the Medy website and figure out what type of eligibility a patient has. And this webinar will be sent to everyone who participated today. We didn't have a PowerPoint, so everything that you see here, it's just going to be the YouTube link for that. And once again, thank you. And if you do have any additional questions, feel free to contact someone from HFS or IDPH. Okay, thank you so much.
Thank you.
Bye.